Hi, everyone. Welcome to the Empowering Patients Podcast, your weekly take on all things related to new care models in healthcare, remote patient monitoring, chronic care management, and hospital at home. I'm your host, Theo Harvey, and I'm the CEO of SensorMed, the leading full service RPM platform in the industry. Today, I'm so honored to have on my podcast Nicole Williams, Portfolio Innovation Partner at UCB. Hi, Nicole. How are you?
Hi, Theo. I'm so happy to be here.
Oh,
How are
great. Happy to have you as well. So, briefly, Nicole is a dynamic leader with over 20 plus years of accomplished career with prestigious healthcare organizations and is currently works in strategy innovation at UCB Pharma. But Nicole has been responsible for leading strategic partnerships between UCB Portfolio Innovation Teams and influential external executive stakeholders by creating innovative collaborations focused on health equity, shared decision making models, and holistic care approaches within integrative health systems. Nicole is also dedicated to serving and giving back to the community. She has served on the Harvard Debate Council Board, New Leaders Council Advisory Board, and United Way of Greater Atlanta. And in recent years, she served on the Fulton DeKalb Hospital Authority Board Grant Selection Committee, which promotes several general healthcare needs by providing grants to community-based health organizations. So, Nicole, you've done a work a lot ton of work in healthcare. So we're just honored to have you here today.
Great. Thank you so much for that, Theo. I might have to take out that 20 plus years. I think it's dating me now.
No worries, no worries. So, well, real quick, typically what we get started with, I like to, set the mood with a general healthcare story that I read in the news. And I think one of the things that we're talking about is remote care and how it's, transforming healthcare. And one of the things I saw in the story was around a startup that is taking advantage of the many hours low income Americans spend in laundromats to help improve access to healthcare. So yeah, so this startup called Fabric Health is aimed at helping low income people receive improved access to healthcare while spending time in laundromats. They say people are busy, but everyone needs clean underwear, said the co-founder. And we need to build systems and services that fit their lives instead of asking them to squeeze something else in. So, I've seen a lot of this. We talked about this on one of my podcasts about, meeting people at, haircuts and getting haircuts, while they're getting haircuts, beauty salons, things like that. What are your thoughts about, especially for, underserved communities, putting healthcare in front of them wherever they are? What are your thoughts around that?
I mean, I totally agree. You got to meet the patient where they are, right? And I hear that time and time again from providers. And that's why you're seeing a lot more people on social media doing certain educational topics. And I think also we discovered during the pandemic that there's a new category in the social determinants of health. And it now includes technology because we realized during the pandemic, a lot of people didn't have access to technology. So they're not able to research certain things about, skin conditions or whatever type of medical conditions that they're trying to research. They're not able to do telederm sometimes or telemedicine. So I think it's great to meet them where they are. And, talking about barbershops, I know that there was another innovative program that actually included education on HIV. A lot of barbers and stylists, they almost act like therapists to a lot of their customers. So just to be able to provide that type of information right where they are so that they can understand how important it is to take care of their health.
No, great point. Yeah, there was a company, I can't remember the name, but yes, they were going to barbershops, giving out blood pressure monitors, right, and helping them with that. And we're looking at doing something around Black men health awareness, and really helping them with, hypertension and diabetes. So I think, trying to reach, and I think we're talking about doing it potentially at a big Kappa event, which is a large, African American, fraternity. And so I think, to your point, healthcare, during the COVID it laid bare the disparities in, underserved communities, especially Black and Latino communities. So
Mhm.
I'm hoping that we're going to see more of these innovation, around, bringing healthcare to the people, not just with mobile buses and all that, but like you said, where they go. And so I want to see more ideas like that hopefully come to the forefront.
It's interesting. I met a resident out of a university in the Northeast at a psoriasis foundation meeting, and basically she was reaching out to me because she was trying to get some funding for her hair loss project that she was doing. And I was trying to find innovative ways for her to kind of get the education across. And so she was dealing with alopecia, and that's definitely been in the news lately, but just talking about hair loss and how many stylists, hairstylists, are the first people to really notice these kind of hair loss patterns in patients. And so it would be beneficial for them to be educated on some of these topics so that they could encourage some of their customers to seek medical care.
Oh, great example. You're right. And it's kind of like healthcare has to be integrated into our lives. I mean, it seems like the whole world stopped because of healthcare, with COVID.
Yeah.
So now that we're slowly emerging of our cocoons and traveling and doing different things, I think we're trying to figure out how we kind of incorporate that now that people are working from home more, right? I mean,
Mhm.
behavior has changed a lot, and people realize they can see their doctor via telehealth.
Yeah.
So I'll be curious to kind of see how these trends continue over the next 10 years. One thing I'll leave with this, during the COVID, someone mentioned to me that, healthcare, we advanced healthcare the most in the last 18 months than we had in the last previous 10 years. So, we did so many different things in healthcare, and the system kind of got exposed a little bit. So I'm hoping these innovations take place. And so, with that being said, let's move into our topic today. I know you have various backgrounds in healthcare, but specifically around skincare. And I would love to kind of understand your thoughts around, treating skin remotely with technology and telehealth. So one of the first questions I have for you is like, again, COVID, the big equalizer and changer for everything in healthcare related. We did see the rise of teledermatology. I think you and I have talked about it previously. What are your opinions for the benefits for this technology, and what's the benefit for the patient and maybe even for the doctor?
Sure. I would definitely say that, telehealth has increased during COVID, right? It was something that really wasn't expected to now it's transformed to like patients are almost demanding it. Like we want on demand everything TV, Amazon service, and our medical care now. So I think with one of the benefits is that a lot of these patients were not able to travel to see providers because maybe they live an hour away and they're being referred to a medical center, and it's kind of hard to get into a lot of these different specialists. So it was taking 4 to 6 months to see a provider live. And I think with the option of doing telehealth, it could be offered at some alternative times, maybe even before clinic or having late night clinic hours. That's something that I've seen that has been done for a lot of different academic centers. But a lot of those patients, they have trouble even getting a ride to these institutions that might be an hour from their house. They have to take off work. And so, when a lot of these patients that have social determinants of health or health disparities, if they're not working, then they're probably not making money. And so, that's not really great for them. But if they could have a telehealth appointment, it might be easier. And then I think also, if they're able to get in a lot sooner, they could catch maybe their issues sooner than later and having it progress. So I think, being diagnosed early is great. And one innovative way that I've heard of an institution in the Northeast and, using telederm during COVID was that they were using a satellite clinic in these rural areas, and they would have the provider on the telehealth visit. And then they would have a nurse or a medical assistant in the satellite clinic in these rural areas actually taking photos of the skin disease issues that the patient was facing so that they could have really clear pictures. The medical assistant or the nurse knew exactly what to take the picture of. They could actually touch and feel the skin as well and report that back to the provider. And that pilot program actually did really well. And a lot of these patients in these rural underserved areas were able to seek care, whereas before they were never getting to the providers.
Mm, great example. I mean,
Mhm.
definitely. I think again, the themes of meeting people where they are, and I love that kind of having these satellite locations to kind of treat patients. Well, look, this is the beginning of it, right?
Yeah.
So, where do you see this going? This technology going? I mean, with treating patients remotely. What are some of your thoughts around that?
I mean, I think adherence rates are going to increase as well. I see a lot of patients wanting to do services at home. So, for instance, within psoriasis, you have phototherapy or light therapy boxes that can be delivered to patients' homes. And I think some of the technology that goes along with that is now providers can actually see when they turn that light box on. So they'll know when the patient is actually doing their therapy. I think that's one way to kind of track and, kind of have a complete circle back to the provider on if the patient is actually getting their treatment. I also see more and more telehealth in regards to therapy, which is, I think, is really great for skin of color patients or even just skin disease patients because they deal with so many psychosocial issues. And so they're needing the therapy sessions to kind of talk through their depression and anxiety. When we might have cholesterol or high blood pressure, when you look at me, you actually can't tell that I have high cholesterol. But with a patient that has psoriasis or maybe atopic dermatitis, it's out front. It might be on their face, their hands, their neck, their arms. And so that brings a lot of psychosocial issues for those kinds of patients. So I really feel that like telehealth with therapy really increased. And I think that is going to be increasingly going forward, and especially helping patients with skin disease. It can help them, talk about, stress management, diet, nutrition, sleep inflammation, as well as like social connectivity and maybe sexual dysfunction. I think those topics is another way for technology, some of these digital applications, when you incorporate telehealth, is being able to actually push information to the patient on those kinds of topics. So if they could get articles or suggestions on how do they reduce their stress management or reduce their sleep inflammation, we know from a skin disease perspective that their disease they'll probably have less flares because it's going to reduce the inflammation when you take care of your psychosocial health as well. So I think that's I know that a direction where we're going. I think also shared decision making tools or digital health tools that help aid the discussion with the patient is something else that's going to be pushed out from telehealth or digital health options. And I think that's because patients want to be heard. They want to go to the doctor and actually talk about some of their psychosocial issues with their provider. So if the patient can, have their voice heard, and then the provider have certain aided tools, whether they like to have an injection or do they like pills, do they like creams, they can show them pictures. And that also helps with patients that may have language barriers as well. I think also with the shared decision making, they feel like they were part of the treatment plan. And it's not just the provider like pushing some information on the patient saying, well, this is what you're going to do and this is what you're going to take. Of course, they are the ones practicing medicine, but it's really important to incorporate the patient's, perspective and some of their concerns in the conversation. So I think those kind of tools are definitely being used. And I feel like that's where telehealth is going.
Wow. No, very, very concise and just really comprehensive because you talked about the clinical aspect and understanding, are they even using it? And so that's what telehealth can help with, but also the ancillary things that go along with that, right? Like the mental aspect, because you're right, there's a lot of stigma associated with these type of conditions, and and there could be some mental conditions that people deal with, and then finally just the like the support that they could use, right? With, like the connections and also research that can be, delivered to them in the format that's digitally. So no, that's great. I think, that's the promise of telehealth and technology, right? And how it can enhance the patient experience wherever they are, and can feel more comfortable about getting the treatments that they want. So that's very powerful. Well, typically, we talk a little bit about, a specific, we really do a lot with my company with a lot of underserved communities, dealing with patients dealing with hypertension, they're alone at home. How do we engage them? So, given your knowledge, around, this area, especially with your work with skin of color patients and the journeys of skin diseases, what do you believe are the key issues facing people of color in regards to skincare?
Well, this is very timely because I just conducted a whole workshop on health disparities from key opinion leaders on social determinant of health across the nation. So these are really top of mind for me, but there are so many, but I would like to focus on just a couple. And I think the main one is trust in the healthcare system. As you know, and our history includes really heinous things like the Tuskegee experiment and the Henrietta Lacks cells being used without her knowledge. So those type of experiences have happened in our history definitely lead to the mistrust of the medical profession for a lot of patients with skin of color. I think also the mistrust comes when there's not a lot of cultural competency from providers. So they might have been misdiagnosed or just passed along to several different providers before they get to one that actually understands their skin disease and their healthcare needs. I hear this all the time that there needs to be more diversity in dermatology. There's not enough minority dermatologists across the nation in regards to training, as well as getting out into the community and serving those patients. So it doesn't really match the general population. The percentage is a lot lower than what we actually see in the United States. And so that leads to patients going to providers that may not know how to treat skin of color. I think some of those issues are also that there's pictures that are not included in medical textbooks. There's not pictures that are included on the dermatology boards when you actually go to be a dermatologist. It's not included in their curriculum training during their residency program. So all of those things lead to things where you're not really sure on how to treat patients with skin of color. And the one that I hear the most is about our hair. So obviously, African American women have different hair textures. The way that we wear our hair is different hairstyles. It might include braids, extensions, cornrows. And with that lack of cultural competency, when you're going to see a provider that doesn't necessarily understand African American hair, they might see it as like, okay, well, you have this scalp condition and I need you to take this shampoo or use the shampoo every day. I don't know a Black woman on the face of the planet that would wash their hair every single day. And so that lack of understanding our needs leads to some of the mistrust as well. So I think that's like one of the biggest one. And then I also think from an educational standpoint, and this is how digital tools I think could definitely help this patient population, is just understanding skin disease in general. We have a lot of patients. I've heard this story most recently is that a patient had really bad scaly psoriasis and they went to a Black dermatologist and the dermatologist was like, have you ever noticed that your skin was, really dry? And she said, well, I just, my whole family just called me ashy skin. I just thought I had dry skin. I didn't realize it was actually a skin disease. And the same thing goes for screening for skin cancer. A lot of African American patients or minority patients, skin of color patients, don't feel like they need to go get annual skin checks because, we don't have as high prevalence of skin cancer in our populations. But, Bob Marley is like one of the famous stories. He actually died of skin cancer. He played soccer outdoors all the time in Jamaica. He actually got skin cancer in his toenail, and that actually led to his death. So it's really important that we do take care of our health and understand and have the education within our communities to promote, what skin disease looks like and how can you get it treated.
Wow.
Yeah.
Oh, that was very comprehensive, and I appreciate that. And yeah, was there any way people can reach out to you and to learn more about the work you're doing, and especially with health disparities and skincare?
Sure. I mean, I guess you can just take my personal email down. It's a complicated one because my name is Nicole Williams, so you have to get kind of creative with your email address. But it's nicole.l.williams, the number one at gmail.com.
Great, great. Well, I learned a lot. So thank you, Nicole, for your time today. I really appreciate it. That's our show for today. But please, everyone, like and subscribe with us on Apple Podcasts, Spotify, Stitcher, wherever you listen to any of your favorite podcasts. Thank you for being on this journey with us toward better patient health. Take care.
Great.